is a major problem that afflicts many people around the world. Today, to learn more about anxiety, we have our guest speaker with us. Here we have Dr. Ashima Srivastava, who is a senior consultant clinical psychologist at Max Hospital in New Delhi, India. So, Dr. Srivastava, what is an anxiety disorder?
Basically, anxiety disorder, it can range from generalized anxiety disorder, which is intense worrying that is beyond one's control, to panic disorder characterized by sudden episodes of fear, being along with heart palpitations, breathlessness, trembling, shaking, or sweating. So dealing with anxiety, it can be challenging at sometimes, as reactions of the body to the perceived danger can vary from person to person. So basically, anxiety, it's a disorder which leads to onset of it's characterized by physiological responses in the body, which are characterized by various features, symptoms like physical symptoms that could include rapid heart rate, breathlessness, constant palpitation, quick breathing or difficulty catching one's breath, or certain muscle aches like stomach ache or headaches, shaking, dizziness, tingling sensation in the body, or sweating, or getting fatigued. There are other emotional symptoms also which could be included, like ongoing constant worries about friends, schools, or activities, worrying about things before they actually happen. Like that means person tends to keep brooding over the same thought, apprehensive thoughts, and also a need for everything to be perfect, like constant thoughts and fears about safety of self or others in the family, like parents and friends or siblings. Also, many kids, if we talk about kids specifically, they tend to have reluctance of going to school or refusal to go to school. They become intensely clingy towards their parents. They feel uncomfortable and uneasy if they are away from their parents. They become very clingy, and they also find difficult or inability to concentrate, and lot of irritability is also evident, and also they have trouble sleeping, and falling difficulty to fall asleep. The sleep is quite disturbed, and also inability to relax. So these are characteristic features. If we talk about anxiety, these are characteristic physical and emotional symptoms which are evidently present.
So you touched on the symptoms. How do you diagnose anxiety?
Okay, how to diagnose? So when we talk about anxiety, see, uh, if a person is having these symptoms, which I have already mentioned, if a person is having these symptoms, the anxiety could be diagnosed as a disorder if these symptoms are present for at least 6 months and they are causing significant distress to the person in day-to-day functioning, and they, even if the person tries hard to get rid of them, they do not go away no matter how much the person tries to relax or stop worrying. And it also impacts impairment in the functioning at school, at home, or along, or when they are, a person is trying to interact with the peer group. So this is the criteria through which we tend to diagnose that a person is having suffering from anxiety disorder.
So at home, how can parents tell if a child is anxious or has childhood anxiety?
So basically, if we talk about anxiety disorder in children, there are certain fears and worries which are typical for specific age groups. These fear will disappear as the child grows older. And however, if these fears or other worries get so big that they begin to interfere with a child's daily functioning, like for example, they avoid activities, they can't relax or concentrate, they may have an anxiety disorder. Some questions to ask yourself as a parent: is my child expressing worry or showing anxiety on most of the days for weeks at a time? Or does he have trouble sleeping at night? Do you notice these symptoms of difficulty in falling asleep and does your child seem to unusually be sleepy or tired during the daytime, or is he having trouble concentrating? Does he seem unusually irritable or easy to upset? So these are symptoms which can help parents to see if their child is suffering from anxiety disorder or not.
Why does childhood anxiety often go undetected? And what are some consequences of undetected anxiety and untreated anxiety?
So basically, kids often keep their worries hidden to themselves and express them in ways that are hard to read. And the disorder can start interfering with the child's friendships, his relationships, and life at his home and work routine in school. Even so, the anxiety still might not be noticeable to parents and caregivers. With anxiety, it is important to note that and remember that how internal it is with your child. It dominates a child's thoughts, but it might not be obvious to the people around. So it's very important that you need to be very much vigilant how much they have internal, how much anxiety is internal. If we do not happen to diagnose anxiety on time, so basically there are certain things which might happen. The consequences of untreated anxiety could be that the number could rise as children might grow older, and also because anxiety disorder, it is cognitive, so they develop anxiety as our cognitive ability develops. And also, kids with untreated anxiety also begin to develop poor coping mechanisms. Untreated anxiety can also lead to low self esteem, academic dysfunction, or self medication through substance abuse. So, parents needs to be very much vigilant and aware of all these symptoms.
So, what are some of the treatments for anxiety, and how can parents help their children at home to deal with anxiety and maybe relieve some of their stress or anxiety?
Basically, parents can help their kids in many forms by using different strategies. And like for example, if a parent is able to elicit that the child is undergoing anxiety disorder or is anxious, and parents are well versed with these symptoms, so there could be possibility that they could use following strategies. First, it's very important that when a parent has once identified that the child is undergoing anxiety disorder, they need to stay very calm in front of their child. They don't need to manifest their anxiousness or discomfort in front of the child, as he or she often looks up to them for how to react in new and uncertain situations, and avoid a lot of reassurance, and instead teach your child how to solve the problems and reassure himself and herself. Another important point is parents must discourage avoidance behavior of fearful situations. Also, it's very important if parents see that the child is having constant anxiety, they must ensure that they plan for transitions in the routine. For example, if a child's anxiety means going to school in the morning is very very stressful, and he feels anxious early in the morning before getting ready for the school routine, it's important that parents bring certain transitions. They allow plenty of extra time in the morning hours before getting ready for the school, because the child has a tendency to feel anxious in getting ready for the school routine. Above all, parents should be available to listen when your child wants to talk about his anxiety to them. So these are certain strategies which I have tried to highlight here. If few of them could be, used, a person can definitely benefit by making use of these strategies.
Yeah, thank you for these great strategies.
So, last question, what is the cause of anxiety?
Okay. So when we come to the etiology, that is the factors which contribute to anxiety, there are certain biological factors which play an important role. So when we are talking about the biological factors, there are certain neurotransmitters in the brain which, when released in an imbalanced amount, they could, lead to the onset of anxiety symptoms. And also the genetic factors, they play a very important role. Symptoms of anxiety, they aggregate in families, and that is, if an anxious child are more likely to have anxious parents, and anxious parents are more likely to have anxious children. Also, there are certain environmental factors which play an important role. For instance, any traumatic experience in the life of a person can also lead to onset of anxiety. Also, there are certain cognitive influences which play a very important role. When we talk about the cognitive influences, that means we're talking about the thinking pattern and the thought processes. So according to information processing theory of anxiety, if we take that into consideration, many children, they have a tendency to have selective attention. So children with heightened anxiety would selectively attend to threatening over non-threatening information. They have a tendency to attend to threatening information more. In other words, they would demonstrate an attention bias towards the threat. So that is also likely to contribute to anxiety. They also tend to expect catastrophic outcomes out of their, thought pattern. They underestimate the future likelihood of positive outcomes. And apart from that, anxious children and adults, they tend to report traumatic conditioning experiences that they attribute to the onset of their current anxiety symptoms. There is also, observation learning. If we talk about the learning influences like vicarious learning or information transfer, when a person indirectly gets conditioned through observing others people fearful behavior, or through verbal communication of any fearful event, that is also believed to contribute to the development of fear and anxiety in many kids. So vicarious conditioning also plays an important role in, contributing to the onset of anxiety symptoms. There are also family influences which play a very important role. For instance, the insecure attachment pattern, if they are prevailing and associated with the child, they are also likely to contribute to anxiety, like, for example, maternal anxiety. Over control and negative parenting also accounts for child anxiety. Parental control also influences social inhibition and attachment interaction. So, over control and negative parenting can also contribute. Parental rejection also plays a very important role. The presence of negative parenting dimensions of withdrawal, withdrawal, or lot of criticism from parent side, or hostility towards the child can also contribute towards the onset of anxiety symptoms.
Okay, thank you for all this information. Thanks for the amazing interview. This information has been very beneficial and educational. Thanks for helping us spread the awareness about this disorder to the viewers. We look forward to interviewing you again on other topics.
Thank you so much.
If you enjoyed this video and want to hear from us again, please like, subscribe, and hit the little bell icon to get a notification when we drop our next video.